Hi folks, Mike here. Thanks for all your great comments last week about the poopy and potty training. We've essentially gone nowhere in the Pappas household since last week, so I'll keep you updated. Anyway, thanks though. I have one question here. It says, "Hi Dr. Mike, how are you?" Good, how are you? "I love your office, but..." Ugh. So that is never a good opening. It's like, I really want to marry you, but, or, I really want to go to prom with you, but. So anyway, okay. I brought my, so this is the question. "I love your office, but," okay. "I brought my 2-year-old to see you a while ago. She had a fever and was coughing for a couple of days. You said to wait it out as it was likely a virus, to keep her drinking, and to only give her Tylenol or Motrin if she were uncomfortable." Sounds like something I would say. "Later that night, I took her to urgent care and they started her on an antibiotic. The next day she was much better. Why did you make me spend more money when you could have just given us an antibiotic when we saw you? Thank you, Sherilyn." Well, I think that's actually a great question because it makes sense. You got the antibiotic and she got better. But I think there's one assumption that isn't accurate, and that's that the antibiotic made her better the next day. So I think as a general rule, viruses give your kids fever 2-3 days, then they break, the kids start to feel a little bit better, and then they may be left with a cough or a cold, runny nose, congestion, diarrhea. But the severity of the course is generally in the first couple days, so I'm not sure if the timing of the antibiotic is what actually helped your child. So our philosophy, I think mine, just good medicine, is that we don't put chemicals in your kids. We don't put drugs in your kids unless there's some absolute indication. I think we all strongly feel that that the most important thing to help all of us is good nutrition, good activity, keep your bodies clean and let the body heal itself. Not to say we don't prescribe antibiotics, but it's not like a reflex. And I think that, that's for all of us here. And you can talk to Michelle, Lauren, Kim, Christy, even if you talk on the phone with Heather and Leah and Kathleen and Jamie up front. I mean, that's going to be pretty much what our slogan is, that we won't treat unless it's really indicated. But it would be easy to treat every single kid that came in with an antibiotic. In fact, I think it'd be easier on us because we'd be able to get you in and out of the office faster. You come in with a fever and a cough, and we walk into the room and we say, "Shh, don't say a word, shh. You don't have to say anything. There's your prescription. Have a good day." And so 2-3 minutes we spend with you in the room. We could see 60-70 kids a day. 60 times 3 minutes, 180 minutes. We'd only have to work 3 hours a day. That'd be easy for us to give you all antibiotics, but we don't believe in that, and that we're not going to do that. Now, I know I've heard that philosophy before, that it's good just to give a parent something so they feel better, so it means that they're in control of their child's illness. But that's just not the right thing to do. And if I were to do that, I'd just be giving you a drug that I don't think is going to work. You go to the pharmacy, you wait in line, you pay $20 or $110 depending on your deductible and the cost of the drug. Then you take it home and you have to force your child to do it or take it. I know a lot of kids will take it, but most of the time a 2-year-old, you have to hold him or her down and force it down their throat. You want to try and do this 2-3 times a day with a medicine that probably isn't even going to help. You're holding the kid down and your husband's helping, your wife's helping. "Honey, you better take this drug. It's going to be good for you." "No, I don't want to take it." "Dr. Mike said it's going to make you feel better." "Dr. Mike's a quack." "Well, he may be, honey, but I still want you to take this medicine." So you just force your kid to take a medicine he doesn't need or she doesn't need for 2 weeks or 10 days, 14 days. It just doesn't make sense for us to do that. I don't think it's good medicine. So We're not going to do that. Even if you came back like a few months later or a year later and said, hey, Mike, remember I brought my daughter in and she didn't get fixed up till we put her on an antibiotic. I need you to put her on an antibiotic this time right away. I would still say the same thing. Viruses are predominantly the cause of illness in children, and there's no reason to give drugs unless they're absolutely indicated. So that's this week's question. Please feel free to comment and give constructive criticisms, if you will. We can always get better. Thanks for everything, and have a wonderful week.